today is day 200 of the national lockdown, and to help us unpack how the journey has been and perhaps what might lie ahead, we've asked the President of the Health Professions Council of South Africa, Dr. Kgosi Letlape, to join us for more. Thanks very much indeed for joining us, and welcome to the program.
Good evening to you and the viewers.
So today's day 200, and looking back to what was lying ahead of us and what actually happened, how do you think we fared?
I think we've had our peak in July and the numbers have come down. But when you see what is happening in Europe, that there's a second wave, we should prepare for a second wave as well. And as we're now seeing, the numbers are up from the numbers of last week, where there's an uptick in the number of deaths and the uptick in new infections in South Africa over the week compared to last week. So we should expect that the numbers will go up. But what is more concerning is the fact that we seem to have taken our guard off. You see more people moving around without masks. We are not using the advantage of the non-pharmaceutical methods of curbing the spread of infection.
So what can we learn from what's happened overseas? What do you think went wrong? I mean, we had New York, which was lauded for the way it went from being the worst to coming down to very low levels, but they're kicking in again. What can we learn from London, from Paris?
I think it's what we already know, that the virus is transmitted from person to person. So when you open up an economy and you increase contact, either through schools, churches, sports, shopping malls, or workplaces, where you are not using masks, you are not physically distancing, you are not sanitizing, you are giving the virus an opportunity to spread. So we need to be mindful of the fact that the virus has no legs. It needs us to spread. And if we wash our hands, cover our mouths and noses, physical distance, we will curb the spread of the infection. And it's that simple, Peter. It's not complicated. It's not what we learned from the US. It's not what we learned from Europe. It's what we already know. And that all of us should not be caught off guard. As the minister says, this is not time to relax. So it's all about our personal behavior and our attitudes that will protect us.
Do you think that we've perhaps become victims of our own... we've been quite good at keeping statistics and quite good at reporting them. And so over time, people saw this decrease, the decrease in the number of new infections, and the levels went from 5 to 1. And one gets a sense that people think it's over.
I think we need to go back to March, that when we closed and went to level 5 lockdown, we had 0 deaths and we had minimal infections. Let's always remember that. And given where we are, where we're still experiencing over 100 deaths per day, we're still experiencing over 1,500 new infections a day, we should know that it is not yet Uhuru. The fact that we've reopened because of the impact on the economy does not mean we should change our behaviors to level 0 behavior. So we should voluntarily adopt level 5 behavior without waiting and expecting the government to take us to a lockdown of level 5. That's how we will overcome.
All right, so it seems inevitable that we will have a second surge of some kind. Do you think that we've learnt enough to manage a second wave and that our health facilities are already well prepared for an eventuality like that?
I wish we could be talking more about that. If you remember, Peter, when we locked down, we said we're locking down to prepare our health facilities. We just concerned that there isn't much talk about how much PPE we have. This is the time when we should be preparing. This is the time when we should have reports from the authorities about our preparedness. This is the time when the field hospitals should be brought into the infrastructure that we currently have. This is the time where we should be engaging with all the private and family practitioners out there and making a marriage between them and the community health workers so that we become prepared, so that we have better contact tracing, better ability to quarantine and isolate, even in the local environment. This is the time when we should be ensuring that all of us have our guard up. We should be talking to society about the different levels of COVID readiness, what COVID readiness means in a doctor's practice, what it means in a public clinic, what it means in an independent healthcare professional's practice, what it means in a regional hospital, what it means in a referral hospital. Having our health facilities have sectors that will be COVID ready so that when the numbers go up, there's no helter-skelter like before. We have adequately stocked up on PPE. We have proper access to clean water and soap for hand washing. We have appropriate sanitation. We have a proper pipeline of accredited suppliers at Treasury-approved prices with proper quality of PPE. We should be having SAPRA telling us who are the approved PPE suppliers that are going to supply us with good quality product approved by the regulator.
All right, so how do we deal with people? Because I think from when we started having these conversations way back then, this was always a theme about people's attitudes and behaviors. The president at one stage says, it's in your hands. And we had a conversation about people. How do we convince people to treat this disease as if it was as dangerous as day one?
I think people should see the facilities and the employers acting seriously. They should see the fact that we have infection control teams in our health facilities. They should see that their employers take occupational health and safety seriously, that COVID officers are still there and they're still doing their job of ensuring that the environment is COVID compliant. We should be upgrading use of technology in terms of ensuring that we keep registers. This thing of people writing manually, when we all have IDs, when you go into gated communities, all they do, they ask you for your ID or your driver's license, they scan it, then they have your detail. So access is easy and your proper information is captured. So that if people need to be traced, if contacts need to be traced, we should be ready in the digital age for that. This is the time to be making those preparations so that they are visible in our health facilities, they are visible in our places of employment, they are visible in our malls. And I don't see that digital vigilance in most of the places.
So, yeah, and I hear you, and I see it, we see it. How do we, I mean, I'm just trying to think, with the second wave, is there something that we do differently to the first wave? The first wave was about containment and flattening the curve. What happens with a second wave? What's the modus operandi for us to manage a second wave, which will be different from a first wave?
The modus operandi is that all of us should now know that if you have any symptoms, you don't go to work, you don't go in public. All of us should now know that you don't venture into a public place without a mask properly worn, covering your mouth and nose. All of us should know about physical distancing. And it just becomes personal habit to move out of other people's spaces and to make sure that they are not in your space. Because when you get into each other's space, you are giving the virus an opportunity to move from one person to another. Basic hand washing, soap and water, that should be readily available in all our places. Cleaning of surfaces. Reports are coming out that the virus lasts for 4 days on money, 4 days on glass. That should not scare people. As long as all of us adhere to washing our hands frequently, even if it's there for 48 hours or 72 hours, if you touch and then sanitize, you are breaking the cycle of spreading the infection. Simple, back to basics. Let us not get into this mindset that if I'm young, I'm not going to get it. We've seen young people die from this disease. Yes, the majority of people that die are over 60, but there's a significant number of people in their 50s, people in their 40s that have passed on because of COVID. None of us are invisible. We're also seeing the challenges of the long-term manifestations of COVID. People that have had COVID, some of them have residual illnesses, renal disease, cardiac disease, chronic lung disease. This is still not a disease to be taken lightly. So let us not be off our guard. The issue of social gatherings. Avoid funerals. If you are not going to make it into the first 100 for that funeral, avoid going to church if you can. So the issue of what we use digitally should be the new norm. Choose. If others choose to go to church, let your place of worship continue with electronic connectivity so that people now have choices.
Right.
We need to ensure that we get into the new normal. If you go back into the old normal, we're going to see a disaster.